another episode on India Health Mission, a campaign that aims to have critical conversations around health and healthcare in India and how we make it more accessible and affordable. As we all celebrate Poshan Ma this month, it is perhaps appropriate to start these conversations by talking about nutrition, which is the starting point for our health and development. Today, we talk about how important it is to be well nourished and how nutrition protects us and helps us manage and prevent diseases. Good nutrition is the foundation for a strong immune system, proper growth and overall well-being. A well-balanced diet rich in essential nutrients like vitamins, minerals, proteins and healthy fats is crucial for preventing malnutrition, enhancing immunity and reducing the risk of chronic diseases such as diabetes, heart condition and obesity. So for this very important conversation, joining us today, we have with us, let me introduce, we have Dr. Sarath Gopalan, President, Nutrition Society of India, Consultant Pediatric Gastroenterologist, Madhukar, Rainbow Children's Hospital, New Delhi. Also joining us, Dr. Nikhil Tandon, Professor and Head of Department Endocrinology and Metabolism, AIIMS, Dr. Sameer Gupta, Senior Interventional Cardiologist, Director, Metro Group of Hospitals, and Dr. Manjul Joshipura, Senior Vice President, Innovations and New Product, Cadila Pharmaceuticals. Thank you all so much for joining, I think, in this very crucial and critical conversation. To begin with, Dr. Gopalan, I would like to ask you the first question here. The state of malnutrition in our country is one of the most significant threats to human health, something, we've been grappling with since independence. Where are India's nutritional challenges when it comes to pregnancy and infancy, and what is India's malnutrition crisis at this point?
Thank you, Amika. So being a pediatrician and a pediatric gastroenterologist, let me start right at the beginning, where the life begins. If you start from infancy, the first and foremost thing is ensuring exclusive breastfeeding up to 6 months of age. These are the national guidelines, and despite persistent efforts, things could definitely improve when it comes to exclusive breastfeeding, but a lot has been achieved over the years. Having said this, that being the first objective, while the emphasis is on exclusive breastfeeding, it is equally important to ensure that at 6 months of age, the young infant is exposed to other foods, which are referred to as complementary foods, the weaning foods to start with, other food items other than breast milk. One of the main highlights of the dietary guidelines for complementary feeding, which have been very recently rolled out, are the emphasis on cutting down on high-fat, salt and sugar-containing foods. And in this regard, use of home-based foods which are adapted to decrease the amount of salt and sugar which are added, keeping in mind the guidelines, would go a long way in ensuring optimum health when it comes to the complementary feeding practice. The third aspect when it comes to infants and young children is, when should we introduce animal milk in the diet? Now, from the standpoint of encouraging and promoting breastfeeding, the most practical suggestion which the pediatricians of the young infant and young child feeding chapter have put forward is that if you delay introduction of animal milk directly till 1 year of age, but animal milk containing complementary foods like ghee, cheese and other food items can be introduced even after 6 months. But the direct introduction of animal milk, it's better if it's done after 1 year of age.
Sure.
And breastfeeding should be continued beyond 2 years of age. Coming to the pregnant woman. Now, there is a program we have already had in place, the anemia program, but we have to look at 4 different aspects here. One is the strategy itself, which has been implemented for several years. The implementation, whether there are any gaps, supervision of that implementation, and recently there's been a lot of interest generated in, can there be any ways by which we can improve absorption of nutrients from the gut, any scientific advances in this direction. And there's the concept of a life cycle approach from womb to tomb. starting right from when the infant is born, right through to the elderly stage.
I think, Dr. Gopalan, thank you for explaining that. So we understand, from breastfeeding and what you've explained about the womb to tomb, the first 1,000 days are extremely critical. Moving ahead, Dr. Tandon, in fact, we do know like India also faces this dual burden where, one hand, malnutrition is a huge challenge, and on the other, there's a heavy incidence of overnutrition and obesity. But often people suffering from obesity also have nutritional deficiencies. Could you explain that to us? How can proper nutrition effectively address this as well?
So actually malnutrition really covers the entire spectrum of both over and undernutrition. Now, when you're obese, you may actually end up with additional problems where, certain vitamins which can get stored in the fat may get primarily located out there and therefore not enough available in the circulating fluid. Obviously, the presence of a range of fats which are not desirable. You need fats. I think that we should disabuse people of the notion that you don't need fats.
Yes.
But you need fats of a certain amount of a certain type. Once you either take the wrong sorts of fat or an excessive amount of fat, it contributes significantly to, formation of plaque in the coronary arteries, formation and affecting by deposition of fat in different body organs, also impeding your ability to metabolize and therefore contribute to elevation in sugars, elevated in circulating blood lipids, and all of these then eventually contribute to a negative overall cardiometabolic risk.
No, thank you. I think what you said about habits and being mindful is extremely critical here, and right fats, I think that's another very important thing because sometimes we go on to extremes. Dr. Gupta, talking of obesity and diabetes, the rising burden of NCDs in our country has become a public health crisis. How many of the NCDs are linked to poor nourishment? What dietary changes would you recommend to reduce the risk of cardiovascular conditions in the Indian population?
So, Ambika, I think, first of all, let me congratulate you when you are talking about such an important thing, which is portion, right? Nutrition. It is the essence of all of us, right? The food that we eat. So, obesity is becoming a major problem. And I, as a cardiologist, see diseases and heart attacks and other problems related to obesity every single day. India is becoming the heart disease capital of the world. It is getting the diabetes capital of the world, and they're all linked to nutrition. Most of the lifestyle illnesses, diabetes, high blood pressure, high cholesterol, some malignancies, they're all linked to food and nutrition. The high salt intake that we have. Indians do love our salts, whether it's in papad, whether it is in achar, whether it is in all the chutneys we eat. They are all very high salt containing things. They increase the risk of hypertension. We love our sugars. You go anywhere, the festival season is coming up, everybody's going to be having mithai, they're going to be halwa, and there are going to be all these nice desserts. It increases the risk of diabetes.
Yes.
And it is not just these sugars, Ambika, it is not just these sugars, it is the hidden sugars. So there is a direct correlation with the food we eat, with the lifestyle diseases that we then inculcate. And they in turn translate into heart attacks and make us, the heart disease capital of the world.
So I think a very important point, the food we eat is directly related to NCDs, and that's why, we see the number of cases increasing so much. So next time when somebody asks us, meethe mein kya hai, we all need to be mindful and not just think of the sweet, but also the hidden fats which you've spoken about. Moving ahead, Dr. Joshipura, we understand that nutrition is of critical importance to our overall health and performance, but how do we get that nourishment in an evolving idea? Nutrition science is working to meet constantly changing global health needs. How do pharmaceutical companies like Cadila respond to that changing need?
I think if you look at the overall landscape, especially national landscape where you have titled this session on India Health Mission, so you already touched upon the two burdens that are overlapping. The other element of the nutrition is basically deficiency of vitamins, minerals, and trace elements. That is also getting emerging as one of the important area in overall nutritional landscape to address. As our country is progressing, we are seeing demands and requirements for such nutritional supplements as well by the medical experts and the patients as well. So I want to talk about the minerals that are important in nutrition as such, and iron is a well-known example. I think everybody knows that India suffered from iron deficiency, anemia for a long time, and even today, in pregnant women, in children, and in adolescents also, anemia is a critical problem. So clearly, iron deficiency is one of the things that can be tackled. The other elements, of course, is iodine, which is being tackled with fortification of several foods. Salt is a classic example. Iodized salt is an example. And then iron, we talked about. Calcium is an important mineral that is being supplemented, and there is a requirement for calcium supplement. And of course, magnesium and zinc are important minerals. So these are the minerals, and then vitamin deficiency is also known, and as we know, vitamin A is required for vision, immune function, skin health. Vitamin C for immune system, skin health, and so on. Vitamin D we know bone health and so on. Vitamin E, K, and multitude of vitamin B complexes, right?
Yeah, no, thank you so much. Moving on, Dr. Gupta, we're talking about nutrition science. Dr. Joshipura was talking about it, responding to the changing health needs. Now, our bodies are under more stress from the environment than ever before. How is nutrition helping our bodies cope? The heart and the immune system, for example, are very closely linked. And again, the heart attacks are going up, cardiac arrest. We hear a lot more. How is this really linked to immunity and obviously nutrition?
So I think nutrition plays a pivotal role in almost 80 to 90% of the illnesses that we have, I would say, non-communicable diseases. So, if you look at the Indian plate, the food that we eat, majority of the food in India is very high in carbohydrates. We are a very carb-heavy country. We don't have much in terms of the fiber and the green leafy vegetables. People think of potatoes as a vegetable. But potato is more of starch, it's more of carbohydrates, it's not giving you the green leafy, the fiber that you need. And that's a very staple food, not only in India, it's across the world in fact. So, the type of food you eat, the quality of the food you eat plays a very, very important and pivotal role. And there's also data to show that if you are having a good, nutritious meal, you may not need supplements. Your micronutrient deficiency is going to be taken care of. A lot of your overall health is going to be taken care of. So the quality of the food is equally important for just good general health.
Yeah, so it's not just about eating. I think it's about what you're eating. I think that's the very important point. Dr. Tandon, while Dr. Gupta did tell us a little bit about the food aspect, I want to ask you specifically for our viewers, what is a healthy diet and what do you mean by a balanced diet? Just adding to what Dr. Gupta said.
So I look at diet, very simplistically as sort of four components, right? Quantity, quality, timing, or the individual portion size, and the spacing, right? So obviously if you eat too much, it's not good for you. Same as if you eat too little, it's not good for you. So quantity is what your caloric requirement is based on your height, based on your current weight, based on what your physical activity levels are. The second part is the quality, and I think Dr. Gupta highlighted that. We are traditionally a very carb-rich nation, which is unfortunate. I mean, many of the diets go up to 65, 70% of carbs, whereas you possibly need to get by with nearer 55 or something in that sort of range, realizing that you still have 45% to make up with, and you have a judicious combination of protein and fats for that. It has to be there, but it has to be a judicious balance. The third thing is, how do you space your meals out, right? And how do you sort of divide? 2 large meals in a day perhaps is not a great idea, because you're actually dumping a lot of calories into your system at one point in time. And therefore dividing them allows much less of what we call glycemic swings or sugars going up and down. And then of course the spacing. You can say, well, I eat 5 meals a day, but I cluster them all together between 10 a.m. and 3 p.m. Again, not a good idea, because you're actually getting everything very close to each other. Spacing them out reasonably. So I think these are practical suggestions which would be of utility for the common person.
Practical and absolutely, I think very, very doable. Sometimes very often we tell our children, oh, how many rotis did you eat? We're not focusing on how much dal or the vegetable they've had, but we're looking at, okay, you've had 3 rotis or 4 rotis, you're good. So I think it's not just practical, very informative. Thank you for that. Moving on, Dr. Gopalan, what is the nutrition gap? How does it affect and how do we deal with, or how can we deal with it?
You see, the most important thing is we've had our leading bodies in the country which have come up with nutritive value of foods, and now most recently, an important step forward has been the practical dietary guidelines are now available and they are being rolled out, and these guidelines address various age groups, and they are also looking at showing practical pictorial depictions of recipes for different age groups. But what we need to consider as practicing clinicians also is how effectively we can roll out these guidelines to the community, and what are the practical challenges we are likely to face depending on the age group we address. So we must distinguish that these guidelines are for the healthy population. When it comes to a particular individual where there's a major nutrition gap, be it a child or an adult, then our clinical judgment takes precedence, and we need to tailor the nutritional approach for that particular individual.
Sure.
This is something we need to do.
Absolutely. Thank you so much. Really well explained. Thank you all for that. More on the nutrition gap and how we can address it when we come back. So do stay tuned with us on NDTV. Welcome back. You're watching India Health Mission, and today we're talking about the critical role nutrition plays for our health. Talking about solutions now, let's move ahead. Dr. Gopalan, how do you assess the impact of Poshan Abhiyan on improving nutritional outcomes in India, and what key areas should be focused on during Poshan Maah, especially since we are in it, to further strengthen its effectiveness?
We have to adopt the practical approach. As the dietary guidelines have now been formulated and are being rolled out, which I mentioned, how do you practically convey the important nutritional scientific messages when it applies to the community? It is important that they understand quantities, types of food, and portions, rather than how much of a particular nutrient needs to be consumed. It is a team approach which is important for an effective rollout of the guidelines which have recently been formulated, and the Poshan Abhiyan. This is one of the important components of the Poshan Abhiyan, where we address the practical issues which are the important points to consider when it comes to delivery of nutrition at the community level.
Absolutely. So I think it's about working critical. It's important to work together. All stakeholders need to work together. Dr. Tandon, talking about, since we are talking about Poshan Abhiyan, what are your suggestions? How can we make high quality nutrients affordable and accessible to all through India's public health system?
I don't think we should medicalize nutrition, right? I think that's the first thing. Saying make it through the public health system implies that we are medicalizing an issue, which is clearly a social issue. So I would look at it from a much broader perspective than to restrict it as a public health system. In fact, I would even stick my neck out so far as to go that giving only cereals at a low cost may actually be counterproductive, because again, the cereals are providing primarily a carbohydrate-rich source.
Yeah.
So I think the whole concept of what should be provided through at lower rates through a public distribution system should not just be restricted to a cereal-based diet. It should be looking at a wide range of food items which provide a broad nutrient delivery to the population at large, and that's the way I look at it.
Okay, great point taken. Dr. Joshipura, what is the role, since we're talking about solutions, that pharmaceutical manufacturers like Cadila can play in making nutrients accessible to a wider population and in bridging the nutritional gaps in the Indian population?
Right. So as we heard, no external supplement can be better than the balanced diet, balanced nutrition diet, right? Having said that, it remains a wishful thinking that everyone would take a balanced diet and everyone would benefit from the guidelines and so on and so forth. So therefore, for example, in a tropical country like India, which is full of 300 days of sunlight a year in most part of the country, why should anybody be vitamin D deficient, right? But the fact of the matter is that vitamin D deficiency is very common, and there's a new emerging science coming out after vitamin D. For example, vitamin D earlier was known only for bone health.
Yeah.
Now there is a strong scientific evidence to suggest that, for example, cardiovascular health can be better, blood pressure regulation can be better, endothelial health can be better, outcomes of patients with cardiovascular conditions would be better if they have vitamin D restored to normal level. There is an evidence in diabetes management that diabetic patient will have a better beta cell function, they will have a better insulin support if their vitamin D levels are restored. Similarly, mental health, respiratory health, pregnancy and lactation. So there are new indications and new scientific evidences emerges where role of elements and vitamin D supplements, in this case, would require an external support. So therefore, the industry would need to come out and be ready with this newer, to meet the newer requirements and newer evidences, and therefore making it accessible and affordable.
Absolutely. I think that's why everybody needs to work together like we were talking. Dr. Gupta, the last question here is nutrition education. Now, how can doctors across specialities come together to create greater awareness around the role that nutrition plays in keeping India healthy like we've been discussing today?
So I think this is a very important question as to how do we become a healthy nation. I know we're all talking about a $5 trillion economy and an $8 trillion economy, but a healthy nation is of paramount importance for it to be a wealthy nation. So, and when you talk about health, clean water and good food are the backbone of a healthy nation. So I think the impetus for improvement has to come not just from doctors, not just from the medical community, but from society in general, like was mentioned by one of the other speakers as well. Education becomes of paramount importance. It has to start at the school level, where the cafeteria in the school, the type of food that they are serving. Are they giving more nutritious? Are they giving more chips and more sodas and more fruit canned juices, or are they giving other kind of more healthy options?
Yeah, absolutely important. On that note, thank you so much, doctors, for joining us today in this very critical conversation. So by raising awareness and promoting healthier and mindful eating habits, we can build a healthier nation. For India to achieve sustainable growth and development, ensuring access to nutritious food across all socio-economic strata is vital, as it leads to a healthier, more resilient workforce and reduces the healthcare burden. Do stay tuned for more on India Health Mission as we bring to you these critical conversations through the series. Thank you so much for watching.